the program coordinator here at WDOM. I'd like for all of you to please stay muted into the Q&A portion later. Before anything, we would like to thank our sponsors, Community Service Society of New York, the New York State Education Department, Westchester County legislators, County Executive Ken Jenkins, and Carvel. So now let's get started. This workshop is designed with the aim of empowering caregivers, family members, and consumers with the knowledge needed to access long-term care, personal care, and support services. And this can allow elderly and disabled individuals to remain safely and independently in their homes. And this is exactly what our programs here at WDOM help achieve. So I will give a quick rundown of our programs. We have our Navigator program that assists New Yorkers with enrolling in qualified health plans, essential plans, and Medicaid through the Marketplace, New York State of Health. We have our Community Health Advocates, CHA, Independent Consumer Advocacy Network, ICANN, which we will discuss shortly in this workshop. We have our Olmsted Housing Subsidy, OHS. It is a program that provides rental assistance to eligible individuals, including seniors aged 55 and older, and adults aged 18 and older with chronic disabilities. We also have our Open Doors, which focuses on safe discharge, assists with stable housing, accessing home and community-based service, and providing peer support. We have housing advocacy as well, which assists individuals and families to obtain accessible and affordable housing. My Home, Not Nursing Home, it is an overarching program that brings all the previous programs I just spoke about. They work together to assist those who want to stay out of nursing homes. So not only do we help individuals get out of nursing homes, we help them stay out of them. Now, a big one, Nursing Home Transition and Diversion Program, NHTD. It is a Medicaid waiver program that helps seniors and disabled individuals who need nursing home level care to remain in or return to the community. If you'd like to know more information about any of these programs, you can visit our website. Um, Lastly, we have our Facilitator Enroller Program that assists individuals who are age blind or disabled in obtaining Medicaid. And to explain this program a little bit more in detail, I would like to introduce to you our senior manager, Darla Lau Paola.
Hi everyone. So, like she said, most of the services that we're going to be talking about today in this workshop are Medicaid funded programs. So services like a home health aid, adult daycare, assisted living program, hospice in the community, and others are covered under Medicaid long-term care. What is the Medicaid long-term care? Well, it's a government health insurance for low-income individuals here in New York State. Medicaid pays for long-term care services when Medicare does not. Is administered by the New York State and the county. So basically, when a person is already under Medicare, is covering 80% of their medical bills, and Medicaid will pick up that 20. Plus, it gives them those services that I mentioned regarding long-term care. So who needs it? Well, seniors that would like to stay in the community and they can get a home care or an aid at home. Adults with a chronic condition, and individuals who have already used all their savings and have really big medical expenses. The application process, that's what our program does here. We help people with the Medicaid application. Basically, you're going to have to gather information regarding your financial, basic information regarding you, and we prepare the packet of forms that have to go to social services. If you need extra forms, depending on your situation, we provide those forms and prepare the whole thing, bring it over social services for you. We follow up with any requests that they will have, and we also get notices about the approval, and we guide you through the whole process. Usually it takes 90 days, the whole process. Westchester County is known by being faster than that. So we will guide you through the whole thing. And if the individual's case situation require, we can talk on behalf of the person with social services. It's good to have someone who advocate for you with social services because, like I mentioned, there are individual circumstances that may be fair, and it's good that you explain those situations to your your caseworker, because depending on that, they can apply certain rules regarding the budgeting. Like I mentioned before, it's a financial eligibility based program. So there's some limits regarding income, there's some limits regarding assets, but also there's some rules that can protect you. And in case of married couples, if let's say the healthy spouse doesn't need Medicaid at the moment, but there's one of them is really in need. So there are spousal protection about regarding the financial. That is good to know all those rules. One of them is a spousal refusal budgeting and a spousal impoverishment budgeting. We can help you with that process. Um, Now I would like to introduce Jaden Salomon, our paralegal. He's going to talk about uh, community health advocate, one of our programs here that help you after the process of the Medicaid application.
Hi, I'm Jaden. Just give me a second. I'm gonna pull up my screen share. Okay. Okay. So as Darla mentioned, I'm gonna be delivering a brief presentation on community health advocates, or CHA. They're the sponsors of this event, and we have a program that we are contracted by through CHA to provide healthcare navigation and services to other people who are looking for those resources. So I'm just going to go over a couple of things that we do for CHA. Um, And here's the first example. One thing that we offer is an explanation of medical bills. So if anyone's received a medical bill that's confusing, any paperwork that they don't understand, we're happy to help out and provide an explanation in those scenarios. We can also help navigate a circumstance where a bill has been made in error. It's in violation of some legal statute. A big example is the No Surprises Act. So that's a protection that people have from when they're receiving medical care that they believe to be in network, and they are told after the fact that the care is not in network because one person they saw, say the anesthesiologist along the way, for whatever reason was out of network. So we would help people get in touch with the resources to access protections like that for billing. And then we also help people understand like why certain outcomes have happened. So understanding why care was considered out of network, or whether coverage is otherwise disrupted. And we can help people figure out specifically what's covered by what, since there's sometimes confusion as to like whether something's a Medicaid benefit or something's a Medicare benefit, or how the supplemental insurance works in with all of that. Okay. We also help people find local clinics and support for them. So clinics, doctors, mental health support within your community, we have resources like that. And we could point you in the right direction for a couple of different places where you could seek assistance. And then we do health education and condition management. So we help people with managing conditions like diabetes, asthma, or high blood pressure. Once again, connecting them to resources, and letting them know, sort of setting them on the right path. Um, we also help people access essential services. So these are like other community pillars: food pantries, housing assistance, legal services, um, things that are not expressly related to healthcare, but which are certainly a key part of someone establishing like uh, a residence in the community and going about their daily life outside of the nursing home. Um, Knowing your rights is also important, so we help out with that. I mentioned the No Surprises Act previously, but we help people understand their rights more generally when it comes to healthcare. So explaining what avenues are available when there is an issue where someone's rights have been violated, helping them get in touch with either legal support or legal resources so that they actually know what rights are being placed at risk. And then it's also helping people deal with other healthcare issues or medical debt of some sort, where sometimes we have more information and resources that we can point the consumers to. All right, next up is Medicare counseling. So we help people out who are enrolling in Medicare Advantage plans. So we help them navigate the different options that are available to you once you decide that you're going on Medicare. Um, so that means determining eligibility for different programs, different types of plans. We help people select Medicare drug plans that make sense with their current financial situation. So that's a point of advice that we can also offer. And we also help people understand the Medicare assistance plans that are available to them. So the trade-offs between different plans, which plans you're entitled to if you're dual eligible, someone on Medicare and Medicaid, and when whether your plan that you've selected will force you to exist within a certain hospital network while you're receiving your care, or if you can just go anywhere if you have straight Medicare. These are all aspects of advice that we give. And then a question like, what do we do more generally? Um, Answering questions about managed care plans, giving advice about plan options, helping people enroll in managed long-term care plans as well as other types of insurance plans, identifying and solving problems with the plan, understanding the rights, like I mentioned, filing complaints or grievances, seeking legal assistance, and then we help with the appeals process internally with insurance companies. So I threw out MLTC here. So I'm going to explain a little bit what that is. MLTC, it stands for Managed Long-Term Care. These are going to be the insurance companies that you get set up with. It's a Medicaid benefit, as Darla was mentioning, but all of your benefits will be run through overarching insurance company. That's the Managed Long-Term Care company. And they'll set you up with a care plan that can include something like home care, home delivered meals, um, resources like toilet paper and paper towels, things of that nature. Sometimes you'll also see like a card for out-of-pocket drug costs if you have a plan that specifically offers that as one of the benefits. Um, so this is a separate health insurance plan, and you add it to your Medicaid and Medicare coverage. So you won't experience a disruption. It'll just change where you're being billed through. Um, and they cover long-term care and a few other services. So this will be coverage for chronic conditions, long-term conditions that uh, other Medicaid does not cover, just because the duration is too long. They don't cover doctors though, so you would see the same doctors that you see now through Medicare. There would be no change there. And then what long-term care services are covered? So these companies could help you out with a couple of different things. That's home care, adult daycare, private duty nursing, physical, occupational, or speech therapies, home delivered meals, medical equipment and supplies, hearing aids or audiology, eyeglasses and vision care, dental care, podiatry, and temporary assistance for the nursing home for things like a rehab stay. If you're doing a more intense stay in the nursing home, you are going to unfortunately have to swap over from community Medicaid to nursing home Medicaid. So that's a different process entirely. And as I mentioned here with the home care, there's multiple subdivisions. So either you're doing personal care services where the insurance company themselves is selecting an agency that they work with to provide you with the aid services, or if you're doing consumer-directed personal assistance, which is where you or a trusted individual in your life would manage your care circumstances, contract aides separately, bring them into the home, and ensure that the time is being covered that you are allotted by the insurance company. Okay, I'm going to pass things over to my colleague Amit. He's a healthcare advocate, and he's going to tell you a little bit about the process of joining a managed long-term care plan, and the various different steps involved in that. Thanks.
Thank you, Jada. Can you please go to the next slide? So the steps to enroll to a mass long-term care plan, like Jaden just spoke briefly before, is the first step is to apply for Medicaid, that Darla explained. And then my role is help you through the New York Independent Assessment Program, which is the agency by New York State that determines eligibility for home care. So you would need to be assessed by a nurse and also get like an eval by like a nurse practitioner or a physician from the same agency to whether basically to we call it as to write a prescription for home care basically. That's how it is. And like once you get that notice, like it's usually called outcome notice, and you get it in the mail, and roughly it takes about 10 days to get it in the mail. It will tell you whether you've been eligible for managed long-term care plan enrollment. And if you are, then the next steps would be to choose various MOTC plans that we would recommend. Um, New York State does give you like a rating system online, but we also recommend some plans just because of the working relationship that we have with them. And our recommendation basically is that you go with the plan that gives you the most hours. Not all plans offer the same amount of hours. Um, they, it's good to call. We recommend 2 to 3 plans, just to give you an idea. But there is also a deadline for every month, the 20th, but we recommend the 18th, just for paperwork and delays. So, in order for you to enroll to the first of the next month. One thing I want to address also is when you do the New York Independent Assessor Program, they are looking at certain activities of daily living, ADLs, and some examples of those are bathing and showering, like assistance in those, personal hygiene, like taking care of your hair, your teeth, your nails, lower body dressing, upper body dressing, like physically need help with eating your meals, not necessarily meal prep, uh, getting in and out of bed, or getting in and out of from chair, walking,
Should be back.
walking and getting around from the home, and also assistance using like a bathroom or shower situation. So the first step to get through NIA is basically calling the number listed there. It's 855-222-8350. They open on Monday to Friday, and they're also open on Saturday. Um, Sorry, the Monday Friday hours are 8:30 a.m. to 8 p.m. Saturday is 10 p.m. 10 a.m. Sorry, to 6 p.m. Um, like I said before, this is like the first appointment. The nurse will walk you through the long questions. They'll ask you about your address, your Medicaid number, uh, and also one thing they've noticed lately is that if someone's going to call for you on your behalf, and you're not the consumer requesting home care, we recommend that you fill out a form that's called Does Need a Rep form. And we can provide you with that form if necessary to uh, help you with the process so it doesn't delay the process. Um, and then after that, they'll schedule you the second appointment, which is like I said before, like a nurse practitioner, and they'll be able to determine whether it is you have a medical stable condition. This thing, keep in mind that they are the appointments are usually telehealth. They're usually by Zoom, but you do have an option to do an in-person assessment. But it does take some time to schedule those appointments, and sometimes when you do have one scheduled, they do like delay it further. Just keep that in mind. Next slide. So we help people who are enrolled in Medicaid managed care, like the Managed Long-Term Care Plan. This is like long-term services, like home tenant, adult daycare, nursing home. More in the sense of like if you're in a rehab for a short term and then you're coming back into the community. We also help with behavioral health services. We're coming from and living with a mental illness or substance use disorder. We also educate people who are newly eligible for enrollment in the Medicaid managed care plan. We can talk to friends, families, social workers, providers, anyone who's helping you with the process and helping you with making your decisions. Next slide, please. Okay, so starting September 2025, the MLTC has made it like this new 80 rule. We call it the 380 rule. It's basically like the examples of ADLs I gave before, like bathing, showering, getting dressed, eating meals. Like you need to have at least three of them to call or to be eligible for long-term care services, or to get home care services, or to get Consumer Directed Personal Assistant Program services. um it's good to know like what you like when you're talking to you or talking to your family member. It's good to have discussion about like what you need help, like what three things you need help, and like with limited like it's usually they want to consider physical maneuvering and limited assistance to qualify um to help to get the services that you need for long-term care. Next slide, please. There is one exception rule for people who are diagnosed with dementia or Alzheimer's. They may qualify for managed long-term care even though they do not meet the 380 rule. Instead, it is a 280L assistance required if eligibility for dementia is present, and assistance includes cueing, supervision, or physical help. Um, Cognitive impairment increases the risk of harm, requiring early intervention, ensures appropriate access to MLTC for individuals with dementia-related function challenges. So that means basically it's just like the standards for someone with Alzheimer's or dementia is just a little bit lower. And the important is the word that they will be looking for is like if you need help with cueing and supervision. Next slide, please. For the dementia exception rule, they people must get a form completed, and it's a DOH 5821, which is basically a doctor who originally diagnosed you with dementia or Alzheimer's has to provide document that you have that diagnosis and the diagnosis. Usually, it's a neurologist that would diagnose either dementia or Alzheimer's, and they would be the one to fill it out. It doesn't have to be the doctor; it could be the doctor's PA that fills it out. But it's like the doctor is the one that diagnosed you with that condition. Next slide, please. That's it. Name it.
All right. Thank you, Amit, Jaden, and Darla, for the information. I know we gave a lot of information, so we're gonna have a little quick break. We're going to answer a quick question. This is just a warmer up, so we're gonna have a second quiz with prices later on. So if we can get the question up, which of the following issues can CHA help dispute? And we're gonna give people about a minute or two to answer before moving forward. Also, I see there's some questions in the chat. We will address that later in our Q&A session towards the end. But you can feel free to put them in the chat. Okay, I think that's enough time. So, like I mentioned, there's going to be a quiz later on, but right now I want to welcome Brian Miller and Deep Mukherjee. Can you guys please tell us a little bit about yourself?
Good afternoon.
Good.
You want to go deep?
Go ahead.
I'm sorry. My name is Brian Miller. I am a certified elder law attorney, having been certified by the National Elder Law Foundation. I do a lot of Medicaid planning, Medicaid applications, asset protection planning, special needs planning, things of that nature. Additionally, I am on the board of directors for Westchester Disabled on the Move. I'll let Deep introduce himself, and then Deep, you could start running the program.
Okay, sure. Hi, I'm Deep Mukherjee. I'm a White Plains attorney, and I am also an elder law attorney. I specialize in most of those areas: elder law, Medicaid, uh, trust and estates, and guardianships. I do work in all those areas, and have certainly been involved in Medicaid for a bunch of years, including some years working for the Medicaid program. So anyway, that's me. Um, all right. So we're here to talk about sort of like the nuts and bolts of this Medicaid eligibility. Um, the important thing here, and this is one of those things that I kind of start out every talk with, is if we can uh, make you understand what the difference is between Medicare and Medicaid, then we're halfway there. Okay. So Medicare is a program that you pay into for through payroll with deductions and income taxes. So you're paying for it. You pay for Medicare, and it's if you have sufficient quarters of payment, it's 40 quarters of history of payment into the system. Once you have that, then you're going to qualify for Medicare. Um, and Medicare is great. It covers emergent needs. It covers hospital. For an additional cost, Medicare Part B and Part D cover physician services, therapy, and a bunch of other services and drugs through the Part D program. And you guys might already be familiar with all that. So that's what Medicare covers. Medicare does not cover long-term care, and so long-term care uh, is covered by a variety of different sources, but Medicaid, as the payer of last resort, is generally the payer for Medicare for long-term care services. So that's why we're talking about it. Medicaid is a means tested program. It is a means tested program, meaning that you cannot have too much money to qualify for uh, Medicaid. If you have too much money, then you will not qualify. Um, and how do they look at this? They basically have two buckets. One is income, what's your monthly income, and the other bucket is resources. All right, how many, what do you have in the bank? What's in your savings account? Um, what property do you own? So those are considered resources. Uh, right now, the income limit for Medicaid is it's $1,800 a month, set in 2026. It They actually haven't put out the latest numbers. I believe it's going up to about 1835. This is based on 138% of federal poverty level. So they pick this number and it gets updated every year. It's currently it should be 1835. It's 2433 for a household of two for a couple, and there's $20 unearned income exclusion. Um, if you're in a program, we talked about managed long-term care, and if you are enrolled in managed long-term care, um, a non-applying spouse can keep about $4,066 a month in income. Um, and actually, um, Wendy, would you be able to put up my presentation or no? Would that be possible?
Let me see our host.
I just want to put up that one slide.
Deep, I might be able to do this. Is that good?
Put up a slide.
Yeah, let me just share.
I just think it'll be helpful to have
I think it's very helpful, and I just think it's important to note that what the numbers you're talking about have to deal with community Medicaid. And there is a difference between community Medicaid and nursing home. And we're not really here to talk about nursing home Medicaid, but the income limit for nursing homes is $50 a month. I'll let
Yeah,
you continue while I try to figure out how to advance the slide. Okay, here we go.
keep going. We just said long-term care is very expensive, et cetera, et cetera. These are just some slides I use. I think you want to go to slide 7 is the one that I actually want to be up there. Yes, that's it.
There we go.
These are these numbers that I was talking about. Okay, so the income limit, like I said, is let's say 1835, 2026. Pending a final publication from Medicaid, they actually have to go in and redo their numbers based upon that federal poverty level. And for managed long-term care, the spouse can keep $4,066 a month. Applying spouse only gets to keep $633 in income under that plan. You actually have a choice of picking one of the other. And if you the thing is that if you choose this the higher income level for a non-applying spouse, then the applying spouse cannot use cannot use the standard spend down um, um, practices. So what happens? So this is the thing: if you have more income if you have more than $1,800 in income, what do? Can you still qualify for Medicaid? And the answer is yes. You can still qualify if you have excess income. The income is considered a surplus. Okay, it's called a surplus or a spend down. You may have heard these terms before. So anything over $1,800 or 1835 would be considered a spend down and must be spent on medical or home care expenses before Medicaid can pay. Medicaid is payer of last resort, so they're going to say, well, you have to spend all this stuff down, contribute that money, and then you can and then we'll pay whatever's left over. But there is a way around that, and this is a very common situation in New York. Because honestly, who can live on $1,800 a month? $1,800 a month is barely may not even pay your rent. So what you can do with your income surplus is that you can pay it into a pooled community trust. All right. There's a special kind of trust, and it's a trust specially for disabled people. But disabled people over age 65 can use a pooled community income trust. And these are run by not for profits. There's a variety of not for profits in New York State that run these pooled community trusts. Those trusts can then, they're technically known as supplemental needs trusts, and they can be used for non-medical needs, or they can be used to supplement anything that Medicare and Medicaid will not pay for. So rent, food, utilities, those things are commonly paid through a pooled community trust because the $1,800 is not going to be enough. Can you go to the next slide? Okay. So here's the resource limit. The resource limit is currently, remember I said it's income and resources. Resources is how much money you have in the bank. So the resource limit is 32,396 or 43,781 for a family of 2. So that 32,396, that's how much you can have in the bank. And that is in terms of what they consider available resources. A community spouse or a non-applying spouse can have up to 162,660 in assets. All right. So those a non-applying spouse can have more assets, and in fact, an applying spouse, so someone who needs the care, can transfer funds to the community spouse, to the non-applying spouse, and get their assets in their name down to the 32,396. And the community spouse can keep up to 162,000. There's also a way, if there's more assets than that, there is a way for a non-applying spouse to say, I'm unable to pay for my spouse's care, and they can just submit a letter to Medicaid. They can refuse to provide that support. However, that does expose the non-applying spouse to a potential support action, a lawsuit or some kind of a claim from the Medicaid agency, the local Medicaid agency. It's similar to child support, where the county, in this case, can demand that that the person pay spousal support. Like I said, similar to child support, and that's if they have excess assets, or that's if they have more assets than the 162,000. And this is applicable to both home care and nursing home care. All right. So let's go to the next slide.
Mind if I just jump in real quick, deeper?
Sure, go ahead.
Because I think it's important. You did mention spousal refusal, where a spouse can say, I refuse to provide for my spouse, and Medicaid can sue the refusing spouse. For years and years, we have not seen Medicaid suing the refusing spouse. However, with the budget cuts in Albany, we're starting to see a little bit more of that. But it's worth noting that if Medicaid does go after the refusing spouse, they're going after the refusing spouse for Medicaid rates, which are roughly about maybe 40 to 60% of the private pay rate. And so sometimes we use that type of planning techniques, knowing that, hey, there's a chance that Medicaid can come after you, but if they do, they're coming after you for the Medicaid rate as opposed to the private pay rate. Additionally, you would have to look at the well spouse or the community spouse's assets. If they're slightly over, it's probably not worth their time and hassle to go after the well spouse to try to recover and recoup funds. And they may let you, maybe you have 170, which is slightly over 160,000 that you're allowed to have. They're probably not worth their while to come after you. So every case is a case by case basis. And I don't know if you have it in your slides or not, but I know you mentioned the $162,000 limit for available resources, but there are exempt resources as well, which don't count against that limit. You're entitled to have a car of any or motor vehicle of any value. I always say you could have the Ferrari in the driveway. Medicaid can't go after it. I'm still dying for that case of a client having the Ferrari in the driveway. You're allowed to have a home with an equity limit of up to, 1.13 million. However, if you have a spouse in the home, they don't look at the equity limit. You are allowed to have, and this is a very New York specific, you are allowed to have retirement accounts, so long as they're qualified retirement accounts, IRAs, 401ks, 403bs, things of that nature, so long as they are put into payout status. Medicaid doesn't count that as an asset. They'll count the income towards that $1,835 a month you're allowed to have, but they're not going to count the principal in those qualified retirement accounts. You're allowed to have a prepaid burial contract or a prepaid burial fund. You're allowed to have a life insurance policy with a cash limit of up to $1,500. I've never seen that, but these laws were written in the 1960s. So there are exempt assets that somebody can have in addition to the 162,000 or 166,000 that the well spouse could have, or the 32,000 that the Medicaid spouse is going to have. So Deep, I'll let you keep running. I wanted to run on that tangent for a second.
No, thank you very much, Brian. That was very helpful. And I look and I see that my slide regarding the exempt resources was I left it out. I sort of put this together in a hurry, so I apologize. But Brian is absolutely correct that so yes, there are exempt resources. So when you say 32,000, we're not counting your house. All right, you're living in your house, so your house is exempt. However, if the house becomes part of your estate, Medicaid will make an estate claim. So that's a possibility. Of course, if it's jointly owned with your spouse and your spouse outlives you, then there is no estate claim at that time. I just want to sort of further expand on what Brian was talking about the spousal refusal claims. Yes, in Westchester, we generally don't see spousal support actions. We haven't seen them in a while. They may be coming back. This is a little bit of a political football, and it does go back and forth. However, some places do aggressively pursue spousal refusals. And New York City is one of those places. So if you are in New York City, you are more likely to see a spousal support action. So yeah, there are these exempt assets. The retirement accounts. Remember when I said that there are two buckets. There's an income and a resources bucket. All right. So with retirement accounts, they don't consider them to go into the resources bucket as long as they're in a payout status. If they're paying out the required minimums, then they go into the income. They go into the income bucket. So it becomes a separate. It is then considered income instead of resources, but the underlying asset is exempt. So just I think I'll just talk really briefly about the look back thing, and then maybe I'll turn it over to Brian. Are you okay with that?
Yeah, I'm good with that.
Okay, good. Yeah, so there is, I mean, and this is, there's probably a lot of information that people give out in terms of the this 5-year look back. It's the 5-year look back is an infamous thing that everybody comes into my office. They're all terrified of that. There is no 5-year look back for nursing home care. Okay, I'm sorry. There is no 5-year look back for home care. There is a 3-month. They look back 3 months, but that's only really for the purposes of doing potentially establishing reimbursement for unpaid medical expenses. The financial look back of 5 years is for nursing home care. So only if you need long-term nursing home care will you need a 5-year look back, and corresponding penalties, and so those all are part of nursing home care. And the things that they're going to look at is, there could be gifts, there could be annuities, there could be giving a mortgage, a private mortgage, and those things, or transfers into trust. Those are all transfers and could affect nursing home care. So I guess we don't really care about it because it is for nursing home care, and we're talking about home care. However, there is a law on the books. Can we go up to slide 11, Brian? Thank you. Yes. So there is a law on the books. There was a law passed in October 2020 by the New York State Legislature that implemented a look back period of 30 months for home care Medicaid. So it was there, it was passed, it was supposed to become effective. However, what happened is COVID. Right? Because of COVID, this law was never implemented. It was held up, and due to various things like federal grants and just administrative issues, It has never been implemented. All right. Um, COVID, the COVID funding that every state received as part of as part of the federal program, uh, has run out. At this point, has all been spent down and is all gone. So there is theoretically in that on that side, there's nothing that's holding New York State back from implementing this 30-month look back. Um, However, the thing about it is that administratively, I mean, also they're still waiting for final federal approval. They could probably receive that um, anytime this year. Um, but what would happen is that administratively, the state would have to issue regulations which define how this look back period would work, what kind of penalty periods would what the penalties would look like. We don't know anything. We have no real information regarding what that's going to look like, and so it would require new regulations. It would also require uh, changing all the New York State computer systems and training local staff. So it's something that's not going to happen instantaneously. It's a months long process, and we should have fairly good information about what's going on. Clearly, I'm sure Disabled on the Move and other organizations will certainly get the word out if such a look back does take shape during this year. But like I said, we'll have a fair amount of lead time. All right, I'm going to turn it over to Brian, and he can cover from here.
Thank you, Deep. So just to add on to Deep, and then I'll continue to take it further. As you noted, Medicare does not cover long-term care. I always say when I give a presentation, if you take anything away from my presentation, is Medicare does not cover long-term care, only Medicaid does. And as Deep went over the assets and income limits with us, this is where sometimes you get a divergence between the type of work Deep and I do and the type of work Westchester Disabled on the Move does. Deep and I are people that maybe we have clients that may have more assets or more income than is allotted by Medicaid. And our job as elder law attorneys is to try to protect those assets, protect that income, move it around, and make you to appear to be, and I put in quotes, poor on paper, so that way you could qualify for Medicaid benefits. Whereas an organization such as Westchester Disabled on the Move often deal with clients that they don't have assets to move around and protect to the extent that some of our private pay clients do. And they're able to assist you at a much more cost-effective rate. They're a nonprofit organization than a private law firm such as what I work at or what Deep works at or any other elder law attorneys out there. And it's important to know that, as Deep pointed out, if you have too much income or you have too many assets, it doesn't mean you will not qualify for Medicaid benefits. It just means that the planning has to be put in place to make you so that way you are eligible to qualify for Medicaid benefits. And there are different planning techniques, and no two people are alike. I often say not even husband and wife are alike, because a husband may have a long-term care policy or a wife might have a retirement account. So every plan in applying for Medicaid is different from one individual to the next. And some of the programs out there that are offered through Medicaid, because we are talking really today about community Medicaid, because we want people to stay home, we want people to live independently, stay in their house, not be in a nursing home. There's a program out there called CDPAP, Consumer Directed Personal Assistance Program. This is a program offered through Medicaid where the Medicaid beneficiary is able to direct his or her own care, to hire his or her own aides, hire his or her own assistants who get paid through Medicaid. It's through a Medicaid intermediary called the PPL program now. But quite often, these people that they're hiring can be family members, children, friends, aunts, uncles, cousins, neighbors. The only thing is the caregiver that is hired cannot be a spouse, or it cannot be somebody's primary agent, such as a healthcare proxy agent or things of that nature. But there's an amazing program out there that allows you to remain at home and don't necessarily have to bring in strangers into your house to allow you to continue to live at home by using the CDPAP program, because you can select loved ones, family members. They just have to be willing to get the proper credentials and get on the program to be paid legally on the books. I know sometimes what I see sometimes is clients will be paying their friend or a friend of a friend off the books, and then that caregiver does not want to become legal, for lack of better term, so, and be paid on the books, and they wouldn't qualify to under the CDPAP program. But if they were willing to go on the books, then they have health care, they have liability insurance, they have workers' comp insurance, they are legit and paid on the books. You're able to have a caregiver come in and provide care for you of your own choosing. Another program out there, and I personally don't deal with this, and Deep, if you do, please chime in, is the personal care services through Medicaid. This allows for home care services. My understanding is that since the implementation of this 3 ADL rule that Amit was talking about earlier, is the PCS program is kind of going by the wayside, because Medicaid, community Medicaid, is requiring that somebody receiving that type of care at home need physical assistance with 3 or more activities of daily living, or if they have a formal diagnosis of Alzheimer's or dementia, then they only need supervision or cueing of 2 or more activities of daily living. And unfortunately, that PCF services, the home care type things, keeping a home, grocery shopping, do not fall under ADLs. And so my understanding, and please correct me if I'm wrong, anybody from WDOM or DEEPA, is that PCS program is going to be going by the wayside. And the only way it'll really be in there is if somebody's already receiving community Medicaid because they need assistance with those ADLs. And then they could tack on those IADLs, such as home care, home services, things of that nature.
Yeah, I'll just chime in there. Most of the services that are available through Medicaid do actually go through the Managed Long-Term Care Program, the MLTC, and the state has folded most of those services in. It may be possible under what's called an immediate needs application. Under an immediate needs application to get temporary care for through the local agency for some time, but they still require that a MLTC application be in place even for the immediate needs. But if there is somebody who has emergent needs, they may be able to still receive some of that care for a brief time.
Yes, and like you said, as a brief time, and right now, unfortunately, we're in this gray area of Medicaid law where there's a lot of changes happening daily. We've seen it, part like Deep says, part of it's political, part of it is state budget and federal budgets, and what we're telling you today may not be true tomorrow, and we're waiting for some things to get ironed out, but you do really have to look, especially now we're talking community Medicaid, at the activities of daily living that Emmett was referencing earlier. If you don't need physical help, physical assistance with at least 3 activities of daily living, or supervision and cueing with at least 2, knowing that you have a formal diagnosis of Alzheimer's or dementia, you may not qualify for community Medicaid. And this is important because prior to September 1st of last year, you only really needed help, and not even physical help, but assistance with 1 ADL. I see I'm holding up his finger. It was only 1 ADL up until September 1st of last year. And so this is still new to all of us in the industry, and we're still trying to figure out how to maneuver this system. And unfortunately, sometimes the only way you learn is by getting a Medicaid denial and say, okay, why'd they deny us? And so I'd say give it a year or so before everything really works out. And organizations like WDOM, other nonprofits, attorneys like Deep and I will have a clearer understanding of what we need to do to really force through these applications to get them approved.
Yeah, I mean, I think it's very important to note that the that idea of queuing and prompting, people who need queuing, who need to be told, you need to take your medications now. I mean, they're able to do it, but they need to be prompted to take their medications. They needed to be prompted, as to getting dressed, things like that are now only, those are only considered relevant factors if you have a diagnosis of dementia or Alzheimer's. So, um, you know, that I think they've made it much tougher, and we're going to see how it goes. But I haven't done any hearings yet, fighting any of that, so it is kind of new. It's kind of a new thing for me, but it's a new and evolving atmosphere out there.
I too, knock on wood, have not had any denials where I need to appeal that yet. But I'm on many organizations as is Deep, and I see the emails that are coming across the listserv quite often. We got denied for this reason or that reason. So it is a new developing area. And it's also going to be very specific to the county. Are you in one of the boroughs through HRA, or are you in Westchester County, or maybe you in a further upstate county where they have fewer cases and they could really hone in on all the fine details? This is new evolving area. And then going back to getting you back to qualify for Medicaid, I know Deep had set forth the limits of assets and income. And so sometimes what we do is we try to protect those assets and or spend down those assets to get you to qualify. And I know one of the things that the WDOM had put on their list is like some of the things that we can do with these assets. Modifications to somebody's home can help you spend down your assets to qualify for Medicaid benefits. Do you need a ramp? Do you need bars and support material within your house? These are things that we're able to use to spend your money on. Maybe you're trying to get below that $32,000 number and you got $50,000. So I could come up with a way to spend roughly $20,000 real quick for you to then qualify for Medicaid benefits by updating things in your house, maybe prepaying your burial contract, converting assets to exempt available assets to exempt assets. And that's where somebody like Deep and I steps in to help you out. Then there's organizations like Westchester Disabled on the Move could also help you. Maybe you're not trying to spend down your assets, but you are looking for other organizations that may be able to help you get subsidized repairs, modifications to your house, subsidized modifications, assistive technology. Maybe you need a walker. Maybe you need bed, a hospital bed, or something of that in your house. I know I spoke with Maria Samuels, who's the executive director of Westchester Disabled on the Move, and I believe she said that you guys either on your website or you're going to have a list of different organizations or programs that may be able to assist people with getting these subsidies or these assistive technologies.
Yeah, and just to mention also one other thing on that is that there is a program called the Nursing Home Transition and Diversion Waiver, which allows people who are nursing home eligible to stay in their homes, and they could potentially get home adaptations paid through Medicaid uh, under that program.
Yes, and that's a very big portion of the work that WDM does is they do help people get onto the NHTD waiver program. Um, if you've been in talks with them and you're waiting to pull the trigger, I would recommend pulling that trigger and getting that NHTD waiver program application in sooner rather than later. Because as I said, there's a lot of evolving areas going on right now in this Medicaid world. And New York State recently got the federal approval to put a cap on the NHTD waiver program authorizations in New York State. And I believe they are going to limit it to 9,400 people statewide. And there are already over 12,000 people statewide on this program. So again, this is where we don't know what's going to happen even next week. You could get the NHTD waiver program application in. You may qualify for it. We don't know if they're going to just start denying because they're already over the cap. This was put into place, I want to say like a week or two ago. It's really fairly fresh of this NHTD waiver program cap. But I know the people at Westchester Disabled on the Move do amazing work with this NHTD waiver program. And so if it's something you are considering, I would recommend reaching out to them, getting that application in sooner rather than later, because there already have more people on the program than is allowed under the new cap. And we don't know what's going to happen. Are they going to just say, okay, we're not accepting anymore? We don't know. And this is also the hard part of being an elder law attorney or even being a nonprofit organization like WDOM is telling our clients, telling people, we don't know, because it is a very changing market right now. And we will continue to fight for you and do our best to get you the programs and the benefits that you need. But working with somebody that has the knowledge, we're not going to sell you a pipe dream and say, oh yeah, you're definitely going to get on an HTD waiver, because we're in the know. We know that, hey, there's a cap out there. It may or may not go through, but I know I spoke with a lot of people throughout the industry, and they're continuing to submit those applications. There's hope that they're going to continue to approve them, because I haven't heard anything coming out of the Department of Health yet that they've put a hard cap on it and they're stopping any new applications. With that said, I know we were going to do some Q&A. I don't know, is that about the time?
Okay.
Sure.
Thank you so much, Brian. Are you guys done with your information?
Yeah, I think
Yeah.
so. I mean,
Okay.
I think we can answer any questions.
Yeah.
I see one, and Wendy, if you can like read us
Yes.
the
But
question.
if it's okay, before we do that, the Q&A, we do have another quiz that I mentioned earlier. This one is 3 prizes. So the winners will each get an Alexa Echo Dot donated to us by a generous private donor. We will contact those winners after the workshop though to get the mailing information and all that. So if we can just do that before the Q&A, if that's okay. It's only gonna take like a minute or two.
Great.
Thank you so much. Can we pull it up? Okay, I think we can proceed now to our Q&A. There are a few there.
Wendy, before we go Q&A, I
Yes.
just thought of one thing, really important. Deep alluded to it, but I really think it's really important. Is Medicaid estate recovery. I know Deep, you alluded to it. I think somehow we got sidetracked, but when somebody applies for Medicaid after they die in New York State, or it's a federal rule, so every state, but what I'm going to talk is New York State specific, is they are required to go after your estate to try to recover whatever money that they spent on your care while you were alive. And however, in New York, they are limited to only recover funds that pass through the court. So if you have a will that passes through probate, or if you don't have a will, it passes through intestacy. If you have assets that pass outside of the court, if they are held in a trust, if they have joint account holders with rights of survivorship, or if they have beneficiaries listed on them, Medicaid cannot seek the estate recovery of those assets. And this is vitally important, because this is a lot of work that Deep and I do, is we try to protect you from those Medicaid estate recoveries. And quite often, somebody's largest asset is their house. As noted earlier, you could have a house with an equity limit of up to 1.13 million, really no limit if there's another surviving spouse living in there. If that house isn't held in trust or doesn't have some type of beneficiary listed on it when you pass away, it will pass through the courts, and then Medicaid will try to recover whatever they spent on your care during your lifetime through the sale proceeds of that house. And I can't tell you how many clients come in. I'm sure you've had them as well, Deep, where the children come in, mom or dad passed away, all they had was a house. They went to some Medicaid mill that didn't tell them about protecting the house. All they had was the house to leave to their children, and now the house is worth 400,000 or 500,000, and they just got a letter from Medicaid saying that Medicaid's going to take the house because they spent $600,000 on their care. So if you do have even an exempt asset like a house, know that Medicaid will come after your estate to try to recover whatever it can for the money it spent on your care. And if you're a married couple and the surviving spouse passes within 10 years of the Medicaid spouse, they could go after the surviving spouse's estate as well. And I've seen this happen quite often. Maybe the husband's in a nursing home, he's on Medicaid, nursing home's paying for the Medicaid, have a $200,000-$300,000 lien. The wife passes within 10 years. They now go after the wife's estate to try to recover the money that they spent for the husband's care while he was alive. So if you do have assets, you do have a house that's usually the biggest asset we're protecting, there are ways of protecting it and avoiding estate recovery. And if you do have those retirement accounts, IRA, 401k, 403b, things of that nature that are exempt, you want to make sure that they have beneficiaries listed on them, so that way it's not being paid back to your estate and then subject to a Medicaid estate recovery. Sorry for that, Wendy, but I thought that was very important.
It's
Yeah,
okay.
absolutely. It's trying to avoid a probate is extremely important. And even doing your bank accounts, putting a joint owner or a transfer on death provisions on your bank accounts, just you want to make sure that you're not leaving anything that would need a public filing of your will or a public filing in order to marshal your assets. And to the extent you can do that, you can avoid a Medicaid lien, which except that that's the kind of stuff that keeps us in business. So, we're good. And if that kind of stuff does happen to you, you can talk to us. You can talk to one of us about it, because there are some, there's some advocacy that we can do in those cases.
Back to you, Wendy.
All right. Thank you so much, Brian, and no worries. Thank you so much for that additional information, and thank you, Dee, as well. So now we're going to go into our Q&A session. We have a few here in the chat. So Magdalena says, I heard that City Pass is being phased out. Is this true? And anybody can feel free to answer that.
I'll just jump in. I haven't heard that at all. The CD Pass program is still there. It is actually the largest home care provider in the state, mainly because, especially upstate, trying to get a conventional aid from an agency is really tough. But you can hire a neighbor, or you could hire somebody who has a car and who can get to you. Because there's no public transportation in a lot of parts of upstate New York, even here in Westchester County, Pound Ridge, Bedford. These are places where transportation is very limited. So CD Pass program is there. What the one thing that the state has done, though, with respect to that program, has created a single fiscal intermediary, meaning that even though the customer, the patient, is supposed to keep their own records of the time that the aide worked, what days they showed up, and submit them. The payment and payroll services, they used to be done by a bunch of different agencies. Just about it, a lot of agencies had started to do their own. The state said no, there's too many of them. We want one. So now there is one statewide agency which handles all CD pass cases, and that is, uh, I, I don't really have a lot of information on how that's working, but it just never seemed to be a really good idea. There are lawsuits that have challenged that, but I don't think that at this point any of them have gained any traction. So we do have this single fiscal intermediary.
Okay, thank you so much. We have another one from Vivian. She asks, once a person is approved for Medicaid, do you assist with setting up the NIAP assessments? Parentheses
I
two.
believe this question came
It's
in
for,
during your guys' presentation.
yeah, for
WDOM
our
presentation.
WDOM staff.
I can answer that. Do you mean like calling, or do you mean like physically setting up like a video? That What do you mean by that, Vivian? Um, we If you need help calling Naya, we can assist you. We can do a joint call with you to do with Naya. But they would require you to give you permission to speak to me. Or yeah, that would basically, or I would have to sign up as a designated rep with the call. But giving verbal okay during the call, that's fine. I hope I answered that question.
Thank you. Then we have from Arsenia. Okay, she said, can we get a copy of this presentation? Yes, we will reach out with resources, including the slides, after the workshop. Then Magdalena has another question. Can you have both Medicaid and MSP, Medicare Savings Program, at the same time?
Mhm.
I can answer that one. Yes, you can have both of the programs if you under the limits that requires.
Okay, thank you, Darla. And another question from Magdalena. The non-applying spouse can keep 4,066 income, but do they need the spousal refusal option, or is it automatically taken into consideration?
Since I talked about that, I can answer that. The 4,066 is what's allowable, is what's allowed. If a spouse has under that, if a non-applying spouse has under that and under the resource limit of 162,000, they do not have to do a spousal refusal. Okay, the spousal refusal option is only if they have more than the 4,066 or the $162,000. The 466 in monthly income and the 162,000. But remember, the applying person can also have some income and assets as well.
Thank you, Dee. And then she would also like to have us explain the difference between Medicaid eligibility for under 65 and over 65.
You want to take a shot at that? You want me to take a shot at that, Deep?
You can handle it.
So
okay
for the type of Medicaid that we're talking about for long-term care benefits, it's actually over 65 or disabled. So if you are disabled and under 65, you would still qualify for this type of community Medicaid, long-term care Medicaid. Their Medicaid is a big umbrella of all different types of healthcare coverage. It covers the Affordable Care Act, also known as Obamacare. It covers benefits for minors, 18 or 21 or under. What we've been talking about today has really been that disabled and aged care for people 65 or older. So if you're under 65, but are disabled, you could still qualify for this type of long-term care. If you're under 55, it's even sometimes better because under 55 does not have a state recovery for benefits you received while you're under 55 years of age. But so there really is no difference if you're under 65 and disabled or over 65 and disabled, it would still be fall under the same program.
Yeah, let me just expand on that a little bit. Generally, if for people who are under 65 and are healthy, they have to enroll through the New York State of Health, the website, and it's what we call Magi Medicaid. It's purely based on modified adjusted gross income. There are no resource limits. They just look at your income, and some of the similar role. There is some expanded income limits, but generally they're similar to what we were talking about. So it is actually possible for an individual under the New York State of Health program to receive long-term care services if they need them. So you can be under 65, you can be enrolled in the Magi program, and you can receive long-term care services. However, what happens then is that generally at some point, um, it could be you applying for disability benefits, or at that point, when you're determined disabled, when there's a determination of disability, either by the state or by the federal government, and especially here's the thing about disability is there's a 2-year waiting period. For younger people who become disabled, there's a 2-year waiting period from the time they become determined they are determined disabled to the time that they actually start receiving Medicare. So those people don't have they may not have any insurance. They have no Medicare. Um, those people can still receive New York State of Health uh, coverage, all right, until the Medicare kicks in. Once Medicare kicks in, then they have to go into the Medicaid program that we were talking about, which is the over 65 and disabled group. But before that, before the Medicare kicks in, before they become dual eligibles, they can still get coverage, and that includes long-term care from that program.
Thank
Great.
you so much. All right, let's see what else. Oh, another question from Magdalena. She said, I understand that level one home care, cleaning, cooking, laundry, etc. by itself is not in place anymore? Question mark. In other words, clients to have need personal cares in order to get home care? Question mark.
Yeah,
Um,
I mean,
Comment.
you want to take that?
so you
Certainly. I mean, you can take it.
so technically, yes, for the new 3D80 rule, it's kind of like hard to get level one. Um, it's almost been kind of eliminated from it. And that's why like giving you with like basic cleaning and laundry, it's kind of hard to get through the NIOP and MLTC. Because
Yeah, I would
before
just say,
level one, you could get it through the county for level one services, but I've just we haven't really seen that since the change of level one approved services.
yeah, I think level one they've been phasing out level one services for years, and there used to be a level three. So, but really now under the New York State regulations, really when we talk about this home care, it's mainly level two services that are what are covered. Um, what Amit was saying about getting assistance through the county is you can go to the Department of Senior Programs and Services, and they have a program called the ISEP program, which does provide the basic level one, like housekeeping, cooking, services. It's sort of what we talk about as hands off care, when you just need assistance with some of your household with household needs. Those can still be available through the ISEP program, which is a separate state program, and they either provide them at no cost, I believe, for people who are financially eligible, or at a lower cost. They have a sliding scale, which enables people to get those services for a lower cost.
Thank you. And Magdalena also asks, is it enough to have a beneficiary of your bank account, or should you put a POD on the account?
I think either there's 6 of one, half dozen of the other, whether it's a beneficiary, POD, TOD, as long as there's somebody to inherit that account after you pass away. And to the extent your financial institution will let you, I always say have a secondary beneficiary. What if you name your child as the beneficiary and they predecease you? Always have at least one backup beneficiary to try to avoid those assets going into your estate to avoid estate recovery. So again, whether it's POD, beneficiary, TOD, in trust for something of that nature, so long as it passes outside of the court after you pass away, that'll protect the asset from Medicaid estate recovery.
Okay, thank you, Brian. Let's see. Rosario asks, are the hours for CDPAP reduced after September 1st, 2025?
I guess I can jump in. There's no change except for the ADL rule. The ADL rule is still in effect, and it's in effect for the CDPAP program.
To add to that, if you were on CDPAP prior to 9/1/25 and you haven't had a lapse in your benefits, then that ADL rule wouldn't apply. However, if you lose benefits and need to go back on CDPAP, or if you weren't on CDPAP before 9/1/2025 and now need to apply, then that's the ADL rule that Deep was referencing.
Thank you so much. Then Arsenia asks, where can you find the different levels and services for Medicaid?
Medicaid has a very extensive website, the Department of Health, the Department of Health. So I don't know if that's a resource that we share, but I know their website actually is helpful. It has so much information that's hard to often find stuff, but the all the information that you would ever need regarding Medicaid can be found on their website.
Awesome. Thank you so much. And then Jessica asks, if a client doesn't qualify for MLTC by NIAB, DSS requests a DOH form along with a denial letter to complete an RN assessment to open the case as level 1 or 2. Do you want to further explain that, Jessica? You can either unmute yourself or further explain in the chat.
I don't know if that was a question or a statement.
Yeah.
But there was one above it, just real quick. Angela had said, what's a POD? POD is payable on death. TOD is transfer on death. ITF is in trust for. Those are all different designations you put on your accounts. Sometimes they're bank specific as to how they term it to leave those assets to the beneficiaries.
Jessica said it's a question, just to confirm. Question mark.
When does it qualify for this?
I'm not sure what the question is, though. If she could maybe clarify what the question is.
Do you mean like when someone gets denied by NIAP? and you want to try to get the services through the county. Is that what you mean, Jessica? Okay. So if you do get denied by NIAP, you do need DSS would require what's called like a they have like their own form. It's a I forget the number, but it's like a Department of Health uh form that like her primary doctor would need to fill out and requesting home care services. And then yes, you would need to send the denial letter with to them as well. And we can assist you with that if you want to, if you need it.
Look at that. It's
Yeah,
two.
there's also an appeal process, which involves a fair hearing, and the state also allows for something called an independent assessment or independent appeal. I'm sorry.
It's a conference. I think it's a conference. They
Yeah,
call it a conference, and then a
yeah,
fair hearing.
right.
Um, but
So,
we sorry to cut you off. Deep. We recommend people to do to redo the assessment. It's been more favorable.
and then
Uh,
resubmit it to the MLTC or resubmit it to NIA. Would that be the route to go?
no, the route to go is just reschedule the assessments that you just had with NIA
Mhm.
after receiving the the denial letter. Um, Because we just fair hearing, I don't know if they'll go in their favor. I just don't know. But it is an option. That is your that it is a possible recourse.
Yeah, somebody just put that in. You can still go to a fair hearing. So, um, I yeah, there's lots of ways to do that. And I guess you guys have great experience and great results with doing some of these. So we're always appreciative of that.
I think that's it, Wendy.
Thank
Uh,
you. Yeah, I think
and
that's all we
one
have,
more thing
right?
to add. Just if someone is doing the assessment alone, we advise someone to be there with you, you know, just to be the advocate when as like your own advocate during the assessment, just explaining how they see compared to what you see, you know, it's helpful. I think it's when we've done that with other clients, it's been very helpful to our clients.
No, it's important too because you want to sell yourself as desperate and destitute as possible. Nobody wants to admit that they're old and frail and disabled and need help, but you have to play it up. And when they come in and do the assessment, they kind of ask, what have you done in the last 3 days? And what have you needed help and assistance doing in the last 3 days? And if you haven't showered in 3 days, they're going to say, oh, they don't need help with bathing and showering. They're not asking you, why haven't you showered? They're just, oh, you haven't needed help showering? You don't need help showering. And maybe that is one of your ADLs and you haven't showered in 3 days because you can't. So having that advocate there to point out these things is very important in getting your benefits.
Yeah, I think that's a great point because you can ask my mom about like what she needs, and she'll say, "No, I'm fine. I got everything that I need." But in fact, she can't do anything for herself, and she needs assistance with a whole bunch of different things. So you can't rely on the person there, and a lot of times, so I usually refer people to care managers who are very good at providing advocacy at these NIA assessments. So it's not really like as a lawyer, I don't really speak that language. But care managers do.
I take the same approach. I say I could argue the law, I could argue the finances. You need a nurse or a care manager to argue the medicine and to argue why you need care. And so I too involve a lot of care managers to help with that NIA assessment.
Thank you both. We do have one last question. Where is the best place to start? Is there someone at WDOM to contact to start the process?
Um, yeah, you can just put me. Me. I'll type in my phone number.
Yeah. Or you can call us, our regular office phone number. One of our receptionists will answer the phone, do a quick intake, and then they would direct you to the designated staff member that can assist you with what you need assistance. Okay, if there are no more questions, I would like to introduce Maria Samuels, our executive director, just to go over our last quiz and the prices.
Yeah, hi. I just wanted to clarify. I made the quiz questions up and I made them a little bit funny, perhaps, and everything, and obviously way too easy to answer. But we have on the last quiz, eliminating all staff members. Sorry, guys, you don't qualify. Um, leaving the our guests to win, and we have 12 winners now. This is going to be interesting. Lillian, how many Alexa Echo Dots do we have?
I do have 9.
9.
Yes.
Okay, then I've made a decision. 9 of you are going to get Alexa Echo Dots in the mail, and 3 of you are going to get $25 ShopRite cards that were donated to us last year by ShopRite. So that's what we're going to do. The winners, I'm only giving the first name, are William, Vivian, Peg, Diane, Rosario, Latonia, Karen, Arsenio, Elise, Magdalena, Eleanor, Julia, Christopher, and Charmaine. So those are the winners. I hope we all have your emails. I think when you registered, you had to register with an email, in order to get the link, right? So therefore, we do need your mailing addresses because everything that we have will have to be mailed to you. So do email us. Let's see. Email info, put this in the chat somewhere, please. info@wdom.org, or we will reach out to you also to confirm that you've gotten it. But we will need your mailing address, and we'll probably not sending it out this week. Next week, we will be shipping it out. The Echo Dot or the card. Expect one or the other that you will get in the mail, but 9 people will get the Echo Dot, and 3 will get a $25 ShopRite card, which is what I would prefer myself. I love cash. And but anyway, that's what you will be getting. Thank you so much for attending. This is the first of 3 series that we plan to do. And we're working on the February one. If you have any ideas, what you would like to see in our future workshops, please let us know. Feel free, 'cause this is for you guys. This is why we're doing this. Thank you, Deep. Thank you, Brian.
Pleasure.
Thank you so much for doing this. And what, Wendy? Thank our wonderful staff.
Yes, of course, all of them. Jaden, Amit, Darla, even Michael, who's behind on
Even Michael,
Zoom.
hiding in the
He
back.
put us a song and everything.
Yeah,
Yes, thank you,
Michael,
everyone.
play us out.
Yes,
Okay. So thank you guys. Bye.
thank you.
Thank you.
Bye.
Bye
Bye,
bye.
everyone. Thanks for attending.
Bye bye, everyone.
Bye.
Bye.